Welcome to the Michigan Trauma Quality Improvement Program. In this section of orientation, we will go over the demographic information aspects of the data dictionary. The patient's first name refers to their legal name with accurate spelling. If available in the EMR, a legal document such as an advance directive or a scanned-in driver's license is a good source to ensure the name and spelling are correct. The patient's last name also refers to their legal name with accurate spelling. If available in the EMR, a legal document such as an advance directive or a scanned-in driver's license is a good source to ensure the name and spelling are correct. As with the patient's first and last name, their middle initial refers to their legal name if noted in their record. Patient's home street 1 refers to the house number and street name where the patient primarily resides. If the patient is a permanent resident in a skilled nursing facility or extended care facility, use the facility address. Patient's home street 2 is often not applicable, but can be used if additional information such as an apartment number is present. The patient's home city refers to the patient's primary city of residence. This data element is only reported when a patient's zip code or postal code is unknown, and it is used to calculate the FIPS code. The patient's home state refers to the patient's primary state of residence. This data element is only reported when a patient's zip code or postal code is unknown, and it is used to calculate the FIPS code. The patient's home zip code refers to the primary zip code in which the patient resides. If a zip code or postal code is not applicable, report variable alternate home residence. The patient's home country refers to the patient's primary country of residence. If the patient's home country is not the United States, then the null value not applicable is reported for the patient's home state, county, and city. The patient's home county refers to the patient's primary county of residence and is reported only if the zip or postal code is unknown. Alternate home residence is reported for patients without a home zip or postal code. This includes patients who are homeless, living in transitional housing or in a supervised facility providing temporary living quarters, undocumented citizens, and migrant workers. The patient's telephone number refers to the patient's personal home or cell phone number. Patient's email address refers to the patient's personal email address or a proxy email used by the patient or surrogate who is often a family member if the patient does not have an email address of their own. The patient's medical record number. This is the medical record number or MRN of the patient at your hospital. It should be a unique identifier to the patient which does not vary from visit to visit. Account numbers, VIN numbers, CSN numbers, HAR numbers, etc. change from encounter to encounter and are not considered medical record numbers. The patient's date of birth is reported as year, month, day. If actual date of birth is unknown, but the patient's age in years is known, report variable age and age units. Age refers to the patient's age at the time of injury. Age is only recorded if date of birth is unknown. If date of birth and age are not available after referencing all available documentation, report an age of 50. Age units are used to document the patient's age in minutes, hours, days, months, or years, depending on the actual age of the patient. Only report age units if date of birth is unknown. Race refers to the patient's race based on self-report or identified by a family member. More than one race can be reported if applicable. Ethnicity refers to whether or not a patient is Hispanic or Latino. Ethnicity should be based upon self-report or identified by a family member. The maximum number of ethnicities that may be reported for an individual is 1. Sex refers to the patient's sex. Element values include male, female, and non-binary. Patients who have undergone surgical and/or hormonal sex reassignment should be reported using the current assignment. Thank you for watching.